welcome to the Autobiography of GIT. I am aluminum salt and that is my generic name. My brand name is Alternagel. My chemical name is aluminum 3 plus trihydroxide. My drug classification is divided into two, the therapeutic and the pharmacological. For my therapeutic, it neutralizes stomach acid by direct chemical reaction. For my pharmacologic, gastric or peptic disease occurs as a result of an imbalance between protective factors such as mucus, bicarbonate, and prostaglandin secretions and aggressive factors such as hydrochloric acid, pepsin, and Helicobacter pylori or H. pylori. Antacids work by restoring acid-base balance, attenuating the pepsin activity and increasing bicarbonate and prostaglandin secretions. My pregnancy category is Category C. Hello everyone and welcome to my mechanism of action. Aluminum hydroxide is basic inorganic salt that acts by neutralizing hydrochloric acid in gastric secretions. Aluminum hydroxide is slowly solubilized in the stomach and reacts with hydrochloric acid to form aluminum chloride and water. It also inhibits the action of pepsin by increasing the pH and via adsorption. Cytoprotective effects may occur through increases in bicarbonate ion or HCO3- and prostaglandins. For my pharmacokinetics, for absorption, it is absorbed minimally. Small amounts may be absorbed systematically. For distribution is unknown and the metabolism is unknown. For excretion, it is bound in feces for excretion and some may appear in breast milk. Now for my indications. I have a symptomatic relief of GI hyperacidity, treatment of hyperphosphatemia, and prevention of formation of phosphate urinary stones. My contraindications, I am contraindicated in the presence of any known allergy to antacids products or any component of the drug to prevent hypersensitivity reaction. Caution should be used in the following instances. I should be used at these instances at any condition that can be exacerbated by electrolyte or acid-base imbalance to prevent exacerbations and serious adverse effects. Also, at any electrolyte imbalance, which could be exacerbated by electrolyte changing effects of these drugs. GI obstruction, which could cause systematic absorption of the drugs and increase adverse effect. You can also use me at renal dysfunction, which could not lead to electrolyte disturbance if any absorbed anticid is neutralized properly. You can also use me for pregnancy and lactation because of the potential of adverse effects on the fetus or neonate.
I'm back. So I have to discuss my side and adverse effects. I can cause I can affect your CNS, wherein I can cause encephalopathy, your GI tract, which is constipation and intestinal obstruction, your metabolic, which is hypophosphatemia, and your musculoskeletal, I can cause osteomalacia. And for the nursing responsibilities, you have to assess for the possible contraindications or cautions. Perform a physical examination to establish baseline data before beginning the therapy. And you have to also inspect the abdomen, auscultate the bowel sounds to ensure GI motility, and assess the mucous membrane status to evaluate the potential problems with the absorption and hydration. And shake, shake, shake. Shake me if I am in a suspension form, and give a small amount of water or fruit juice. And you have, and also after administering me through a nasogastric tube, you have to flush the tube with water to prevent obstruction. And also, when I am used as a antiuretic, antiuretic encourage an increased of fluid intake to enhance my effectiveness. And periodically monitor the serum calcium and phosphate level, and observe the patient for signs and symptoms of hypophosphatemia for those breastfeeding patients. Although drug may appear in breast milk, um, and no problems have been linked with with me upon using in a breastfeeding women. For those pediatric patients, you have to use me cautiously in children younger than 6 year old. And for those geriatric patients, geriatric patients commonly have an increase of GI motility. So they may become constipated upon using me. And also, don't forget, you have to provide a patient education. You have to caution to take me. You have to caution the patient to take me.
Goodbye! That will be the end of my blog. I hope that you have learned something. Stay safe and God bless.